Thank you, everyone, for joining this afternoon to award Senator John Boozman with the STS Legislator of the Year Award. For those of you that don't know me, I'm Alan Speer. I serve as the chair of the STS Council on Health Policy and Relationships and as a member of the STS PAC Board of Advisors. I'm a cardiac surgeon and the medical director of cardiac surgery for the Inova Health System. I also had the honor of receiving the Society of Thoracic Surgeons 2021 Distinguished Service Award. Although this was meant to honor an individual, all of us in our specialty recognize that nothing that we do is individual. It requires a team to accomplish what we do in our profession. I would like to recognize our Washington legislative team, Courtney Yo, Nick Beek, Kelly McCone, and Julie Mavis, who all share in this recognition, as well as our Legislator of the Year, Senator John Boozman, who played such an instrumental role in supporting our specialty. This is the 6th year for the STS Legislator of the Year Award, which honors a member of Congress who has defined legislative record on issues of importance to healthcare and cardiothoracic surgeons. Normally, we would present our award at the STS Legislative Fly-In in Washington, D.C. However, we are not yet back to normal given the pandemic, and for this year, the virtual platform is necessary. Senator John Boozman has been a stalwart champion of strong policies in healthcare delivery and has been an advocate of the STS advocacy priorities during his tenure in the U.S. Senate. He has represented Arkansas in the Senate since 2011, and prior to his senatorial career, represented Arkansas's 3rd Congressional District in the U.S. House of Representatives. Currently, Senator Boozman serves on the Senate Appropriations Committee and the Senate Committee on Veterans Affairs. Senator Boozman's passion for affordable and excellence in healthcare for all Americans stems from his background as a provider. Prior to his career in public service, he practiced for many years as an optometrist who co-founded a clinic that has become the major provider for eye care in Northwest Arkansas. In addition, Senator Boozman has had firsthand knowledge of healthcare as a patient. He's taken an active interest in issues facing physicians in cardiothoracic surgery. Over the past 2 years, Senator Boozman led Senate communication to CMS opposing provisions of the Medicare physician fee schedule that would have dramatically reduced reimbursement for cardiothoracic surgery by as much as 13%, as well as reductions for all other surgical specialties. On one of those letters, he was joined by over half of the U.S. Senate, which in this day and age is no small feat. In December 2020, Senator Boozman introduced Holding Providers Harmless from Medicare Cuts during COVID-19 Act in order to mitigate these cuts in reimbursement. He readily understands that the primary impact of these reductions were not cuts to provider compensation, but the significant adverse impact these reductions will have on access to care by our Medicare beneficiaries. It is due to his efforts that I have no doubt that Senator Boozman was one of the biggest reasons why Congress took action to mitigate these cuts to reimbursement. Senator Boozman has been active of other priorities important to cardiothoracic surgery. He supported increase in the number of Medicare-supported residency positions, emergency assistance for rural providers during COVID-19, and confronting the youth e-cigarette epidemic. Senator, thank you for being with us, and I'd now like to introduce our STS Legislator of the Year, Senator John Boozman.
Thank you so much, Dr. Speer, and this certainly is a great honor from the thoracic surgeons for y'all. Again, let me hold it up here. So again, thank you so much. I really do appreciate it. Certainly, there's a greater appreciation for the medical profession as a result of the COVID-19 pandemic, and rightfully so. You all are truly the real champions. That's true in my own life. I have thoracic surgeons to thank for saving my life. In fact, my family were so excited when I was going to get the award, and my staff, but they all voted that I should be giving you all the award. In the sense, I simply wouldn't have been here if it hadn't been for the good hands of Dr. E.J. Chauvin in Rogers, Arkansas, and then a follow-up procedure in 2017 that was done by Dr. Speer. So I have a newfound appreciation for your skills and guidance, which have been essential in helping me recover and heal. I knew I was in good hands, and I knew that I was in good shape on our last appointment. Dr. Speer visited with me, said I was in great shape, and then I asked him about Medicare and this and that. So most of our time was spent discussing those things. So again, like I say, I knew I was doing pretty well. As a former provider myself, I really do know the importance of advocating for policies that support physicians and providers and expand access to health care. The good news is we can and do find common ground in Congress to support the needs of the healthcare community. We've seen that with the bipartisan support to prevent the Medicare cuts. My colleagues and I understand the proposed cuts by CMS would further strain our healthcare system. Last December, as was mentioned, we were able to get legislation to prevent the Medicare physician payment cuts, because I know it's disingenuous and even counterproductive to say that we support healthcare providers and the crucial role they're playing to fight against COVID-19, and then impose additional burdens that truly do impact their bottom line. Medicare payments are helping physicians, hospitals, and nursing homes continue to be in a position to provide the care and treatment communities rely on, especially during the period that we've had and during the still public health emergency. I'm pleased Congress was able to come together again to recently continue delaying the Medicare physician payment cuts. We need to create an environment that encourages physicians to maintain their practices so we have access to healthcare services and providers and continue administering life-saving treatments and vaccines. Avoiding these cuts during a pandemic is crucial to our healthcare system. And just as importantly, we need to have the personnel available to treat patients. Avoiding the cuts, period, whether in this time or in the future, again, is vitally important. Recent poll of frontline health workers found that the majority are burned out, and some are even considering leaving the industry altogether as a result of challenges over the last year. The demand for care will continue to grow, so we need to make sure we have the trained professionals necessary to meet the demand, as well as policies that expand the physician workforce. That's why my colleague, Senator Bob Menendez, and I introduced the Resident Physician Shortage Reduction Act. This legislation would allow an increase in Medicare-supported residency programs. It will enable us to better provide quality health care throughout the country. For a state like Arkansas, where up to half of medical school graduates leave the state for residency training, this is an acute concern because we know that a majority of doctors establish their practice in and around the region where they complete their instruction. So as you all know better than anybody, there are a lot of challenges and issues to confront when it comes to improving our healthcare system and creating an environment that gives providers confidence that this field is viable and worth the tremendous investment of time, resources, and energy that are required to be successful. I appreciate the advocacy of the Society of Thoracic Surgeons very much. Give yourselves a pat on the back for the work you've done and are doing to share about the state of your industry and profession with lawmakers. Your team in Washington does a marvelous job. And again, I can't stress to you how important your advocacy is. Working together, we can find common sense solutions to issues that impact physicians, patient care, and access to health care. Being recognized by this group is certainly very humbling and meaningful. To receive this honor at a time like this is something I will always be grateful for, and will also serve as an inspiring reminder of the importance of supporting our healthcare professionals. So thank you again, and please continue to stay engaged with me and those people that represent you and their staffs, all of your elected representatives, so we can all work together to get our healthcare system where we all want it to be: sustainable, accessible, and delivering care that leads to better, healthier, and longer lives. I know how difficult it is for you to plan when you've got this these looming perhaps cuts in the future. So we've got to get that ironed out. It's difficult. You know, you may want to invest in a new piece of equipment, learn a new procedure. If you don't know what the Medicare reimbursement is going to be for it, then this and that, or just overall cuts, it becomes very, very difficult. I can remember my brother and I'm an optometrist, practiced with 4 other optometrists and 5 ophthalmologists, and had a surgery center. I really do understand these things. I remember when we changed the Medicare reimbursement, you know, as we went down that path, I remember how complicated it was and how we all, you know, you coded very safely because you knew you wouldn't get in trouble, and you can make a living with your Medicare patients doing that. Then the cuts started, or we didn't get increases, which is the same as a cut. And so you started coding more efficiently. You actually coded what you did, you know, making sure that you did nothing inappropriate in that way. But again, got paid for what you got. Then we started bundling. We started all of these different systems, and again, continued cuts. So people started seeing more patients. They got more efficient. Now we're in a situation where you can't see any more patients. You can't do any more, and yet, you know, are faced with the possibility of again, not increases, which is the same as a cut, or actual cuts. So I do understand. I will do anything I can to help you. And the good news is we have been successful. This is a very bipartisan effort, and we do appreciate all you all do and all you represent. And as I said, I'm a great example of utilizing your services. So you've got a special place in my heart. In fact, Dr. Spears has actually seen my heart. He knows that there are some legislators, despite what some would say, that actually do have a heart. That's a good thing. So